I don't want to scare people
You're
away.
right.
So when we sit you back, after we've done the photographs, we'll sit you back and we document what currently exists in your mouth in regards to missing teeth and fillings and caps and
Everything depends on the age of the person, what's happening?
pretty much. But you know, we want to look at this is my adult exam. This is what I do with everybody that's above 20 years old. You know, and sometimes a little bit younger than that. So we want to document what's existing in their mouth because, again, I'm going to refer to this when I'm doing your treatment plan. I want to know what kind of fillings you have in there, what kind of caps you have in there, any missing teeth that you may have. And it's just a general documentation so that for general purposes as well. Everything is put into the computer, so this is your record now, okay? So once I've documented what exists in your mouth, I do what's called an oral cancer screening exam.
I never heard of that.
Well, the oral cancer screening exam is very important because although oral cancer doesn't affect a lot of people, maybe 2% of the population, it's devastating if it's not caught. So we look at all surfaces. We look inside the cheeks, inside the lips, roof of the mouth.
Is it common, oral cancer?
No, it's not that common. But I've caught it 3 times in my career.
Have you? By doing that?
I do this exam, yeah. The most important place that it occurs mostly is at the posterior border of the tongue.
Posterior is where? The
back side of the tongue.
Whoa.
So it's hard to see.
Yes.
And you don't even recognize it's there many times. So we take this 2x2. I tell the patient to stick their tongue out, and I grab their tongue, and I pull it out just a little bit so that I can see the back side of their tongue.
Could Elizabeth pick it up with your
Elizabeth
hygienist?
actually does it at every visit that she has the patient in to clean
She's the
their teeth.
hygienist?
She's one of my hygienists.
One of
yes.
them?
One of the main hygienists that I have.
You have a couple?
I have 3 now.
3 now.
Elizabeth's my most full-time.
How important it is then to get a cleaning, huh?
Oh, it's extremely important. I'll explain that next, because the next part of my exam is the periodontal examination. Okay, now the periodontal examination...
Periodontal means what?
Gum tissue.
Gum tissue.
So we look at the supporting structures that surround the tooth. Let me put it that way. So the supporting structures that surround the tooth are the gums and the bone, the jawbone. And we can make an exam by just looking. You can see if the tissue is red or inflamed or edematous, swollen. We can also, we do what's called a probing of the gum tissue that surrounds each tooth. So we'll take measurements, and we use this here. People say, that's not going to hurt, is it? You feel it, but it's not sharp. It's blunted. It's
It's
a blunt.
not bad.
It's a
Not
blunt
bad.
object, and you'll notice, Phyllis, that it has little graduated marks on it.
Marks on it.
Right?
I'm like a screwdriver would have, like it has some
Well,
indentation.
this is more for measurement.
Oh.
Okay, so each one of those marks is a millimeter. So what we do is
And these are all sterilized before you touch me?
They are sterilized.
Okay.
Right. These are measurements we make. We make 6 different measurements around each tooth. And that will tell me how healthy your gums are, as well as other signs. But for example, if you have a 1 millimeter pocket, which is just one of these, that's really good. And good numbers are 1 millimeter to 3 millimeter. Anything, and this is measuring the pocket of gum that surrounds each tooth. Now, if that pocket of gum increases to above 3 millimeters, it makes it, what the research has shown us is it makes it very difficult for you as a patient to keep it clean. So the bacteria sits in this pocket and gets worse and worse and worse if you're not getting this bacteria out. So if I recognize that you have some pockets in your mouth that are over 3 millimeters, I want to reduce those pockets, get the swelling to go down so that you can take care of yourself better and not have a progression of the disease.
So using the electric toothbrush and you tell me what to do.
Correct, right. Or I bring you back. I might, depending on how many of these 4, 5, 6 millimeter pockets you have, I might have to see you more often. The hygienist might have to see you more often. So she might bring you in for a general cleanup. Then she might go back and she might really thoroughly clean out those areas that are deeper than they should be.
That tartar or that?
Tartar or plaque.
Yeah.
And she might have to use a little Novocaine or something to numb you up so it's comfortable for you. I insist upon that. I want the patient to be always to be comfortable, because in the old days we weren't always that kind to patients. So I really want to make sure that patients are comfortable. So then once that's accomplished, we bring them back 2 weeks later, 2 to 6 weeks later, and see if what we did the job. If just a matter of cleaning those areas out does it, you're good to go. We might have to see you in 3 months, we might have to see you in 6 months, but at least we don't have to do any further treatment that requires further
Even
help.
if you're doing dental floss, you're doing your electric toothbrush, you still need a cleaning every 6 months, don't you?
You do. There are some people, the American Dental Association recommends that we see you every 6 months. But in all honesty, I'll see people that really do a wonderful job cleaning their teeth, and their pocket depths are 1 to 3 millimeters, and their gum tissue is pink and healthy. And I'll tell them, you don't have to come in every 6 months. You can come in every year if you like. But most of them insist. They say to me, look, my insurance company pays for it twice a year. I'm going to get it twice
Yes,
a year.
I
said,
agree.
well, that's up to you.
And
But
bad breath and a million other things that we eat and
yes,
whatever.
certainly. But the key here is that you take care of yourself. There's only so much we can do. I mean, think about it, that we're only seeing everybody once every 3 to 6 months. In a 3-month period, if you're not doing a good job at home, you're going to have a ton of accumulation of stuff that's going to cause disease.
When you say disease, Dr. Wolfert, cancer?
No, I mean periodontal disease.
Periodontal disease.
Yeah, that's gum disease.
What would cause oral cancer of the mouth? That is a cell gone away?
Yeah,
Or just-
it's somewhat genetic, but smoking, drinking, not taking care of yourself generally, that's usually what is causing oral cancer.
Do you talk about smoking to people?
I do. It's a very difficult habit to quit.
Yeah.
I understand that. I offer Chantix if they want to.
Chantix is
Chantix is a pill that you take. It's that helps you quit smoking. It's not for everybody, but I'll offer that. There's a fellow up in South Weymouth Square. He's a hypnotist.
I've had him on.
He does that.
Yes.
Sometimes chiropractors do that.
Yes.
So there's a lot of different ways, but sometimes, biofeedback. There's a lot of different ways you
Whatever
can
will
approach.
work.
That's what I say, because it's not an easy thing to quit.
No.
I watched a friend of mine who's an avid smoker watch his father pass away from lung cancer, and his kids have pleaded with him to stop smoking, and he can't. And so ever since my experience with him, I don't judge anybody,
No.
because
You
it's
can't.
a difficult thing.
Yeah.
All right.
I hope
So-
heaven has some fudge.
Yeah, that's right.
If I'm going there or down below.
Yeah, that's right. So the last part of the exam, Phyllis, is really revealing to the patient. And I do this at the last thing because I want it to be revealing. I want to evaluate how well they're cleaning their teeth, okay? And the way I do that is I use this disclosing solution. It's red solution. I'll take 10 drops and I'll put it in this. And on the Q-tip,
That's the Q-tip.
that's what the Q-tip's
This is for.
Yeah. I'll take the red and I'll put it on their teeth all over. And then they sit up and they rinse out once. I always say, don't cheat and rinse out more than once, but rinse out once. And what this red disclosing solution does, it's called Reveal, it's a brand name, is it sticks to plaque that you've left behind. So if you're not doing a good job at home, then this is going to show you where you need to do a better job. And I think that's a great tool to use.
That is wonderful.
And it's been used for many years. They used to.
You're telling us 5 minutes,
I got
Dr.
it.
Wolfert.
Got it. 5 minutes.
Yes.
So I'm almost done, anyways. So, anyways, I use this as a feedback mechanism. I also document what it is, and I tell them, and I show them how to brush and floss correctly. A lot of people floss incorrectly. I show them how to do it, and then.
Quickly, how you take it? Any particular floss you like, or
No, I think unwaxed.
Unwaxed.
Any unwaxed floss. But you know what? Any way you can clean your teeth thoroughly is okay by me.
should take about 5 minutes?
It should take you as long as it takes.
Okay.
Right?
All right.
So once this is done, I don't want to send them home with red teeth and red gums, because That's bad marketing. So I send them into the bathroom and I tell them to brush their teeth and get it off
And you give them a toothbrush.
give them a toothbrush and some.
Isn't that nice? And some toothpaste to
Yep,
take home?
that's right.
I think that's great.
All right, I think so too. I think it's awesome. but
And you have
that's
something
not-
there.
Well, here's what happens. After the end of the exam, I sit down at my computer and I make them up a report. And I send the report in the mail
Do you?
to them.
Aren't you
And
something?
so it addresses everything that I found. And then if they want more discussion, we'll have it the next time that they're in.
You
okay?
send it?
Send it
I've
to
never
'em.
heard of a dentist ever
No,
doing that.
that's why I think I do things a little bit differently.
That is wonderful.
So then when they leave, before I sit down and do the exam, they leave and they go to the front desk and they make their appointment for their cleaning appointment. I don't do their cleaning appointment at their first visit many times because I want to do the diagnosis first because many people need more than just a regular cleaning of their teeth. They need more thorough cleaning, maybe come in 4 times instead of once. It's hard to tell. And so I don't think that the patient practices that get you in, clean your teeth, do the x-rays, are doing a very good job or a very good service. That's why I do it this way.
This seems so thorough and complete. Now, how should we clean our teeth? Should we do electric? Do you sell them?
Well,
Practice?
I am doing a little bit of a promotion right now. So if a new patient comes to me and they go through this comp exam process, they get this Sonicare. I believe so much in their home care technique that
Sonicare is marvelous.
Yeah, I think that the Sonicare toothbrush is the best, and the research
Do
shows
you really?
that it is.
Okay, that's
So
wonderful
this
to
is-
know.
This is a model. This is the lowest model that they have, but it just gets patients to use it.
You give it to them?
I give it to them.
Wow.
So
They're
that's-
very
that's-
expensive
that's-
things to have.
Well, this is the basic model, so it's not too bad. But I feel it's so important that they learn how to clean their teeth properly.
What does this do, Dr. Wolfert, that a toothbrush won't do? That a regular toothbrush
You know what
won't
it mostly does? It slows you down.
do? Okay.
Because it does the motion. Some people aren't dexterous enough to do the motion that's correct. But what it also does is if you're using it properly, you put it in place and you leave it there until a minute goes by, or not a minute, but 10 seconds goes by. Then you move to the next place.
When you say leave it in between the gum and the tooth?
Right at the union of the gum and the tooth.
Okay.
All right? You leave it there, and then you go to the next, after 10 seconds, you go to the next place, then you go to the next place. I think most people, when they're using a regular toothbrush, they're in and out of there.
What
Right.
about implants or anything? You can use this, right?
Oh, anything, yes, anything. So that's one of my promotions, is to give this to the
Rosalind,
patients.
look at you're going to get this.
If she goes through the comp exam process. The second thing that I'm doing is if an existing patient refers me a patient, I give them a gift certificate to the Stockholders Restaurant for $50.
You're kidding.
So, Rosalie, if you come in and you send your son or daughter or your husband in,
She doesn't have
you'll
any
get
of
this-
that.
You'll get this $50, all right?
My,
$50 gift certificate.
$50. Boy, stockholders must love you.
They don't, you know what?
Do they even know you're doing that?
They probably don't. I went and asked them if they would give me a deal on there.
Would they?
No.
They wouldn't.
No, they wouldn't.
That wasn't such a great business
No,
decision.
I don't think so, but they do.
I wouldn't go to Stockholders to go to someplace else.
Yeah. It's a good restaurant, though, so
Yeah.
I thought that
That's nice of you to say that, even though he wasn't, maybe the
No.
owner doesn't realize that.
No, he might not, but they do it.
They'll know now.
They will know now. They do one minute. They do know they do their own promotion at Christmas time. They'll sell a $50 gift certificate for $40.
I know it, I know.
So I think what they want me to do is come back and buy a bunch at Christmas time.
I don't care. That was poor business practice, and I would have, if I was them, I would have called the owner or the general manager and said, this is what this dentist
Yeah, I
is
mean, it's too
doing.
bad that they didn't, but that's, well.
But we have to say goodbye. Are we all set already? Okay, bye-bye.